We mentioned that there are ways to delay, possibly stop, or even slow down labor. So how do we do that?
Well, there are certain medications that we give. In particular, something called magnesium sulfate is one of those medications that we tend to use not only to prevent the delay preterm labor when that happens, but also to allow us time to mature the baby's lung and get certain medications to the mom that will allow the lungs of the baby to be mature. Because the idea is not only to prevent preterm labor, but if preterm labor cannot be cannot be stopped, you want to have a baby that has a very good chance of success.
Absolutely. Now, I read here that a key way to kind of spot if you're going into early labor is contractions, right? So how do you know, do you count them? Is there a way, someone once told me you could put your fingers on the abdomen to figure things out in terms of maybe you playing doctor for just a few seconds?
Well, contractions is going to be part of the normal process of labor, and not necessarily they mean that they're going to be preterm labor. I think that the important thing when you are monitor contractions is finding out whether those contractions are rhythmic, whether they happen at a certain time, and how long do they progress for. I mean, you're going to have contractions through the whole pregnancy, especially when you're dehydrated. If you have some type of medical condition, maybe you have the flu, and you're just not taking a lot of liquid, and that will increase your chance of having contractions. So I think that in general, anytime that you have contraction, the most important thing is for you to monitor and time them and see how often they are. If they are irregular and they're spaced out, that most likely is not an evidence of preterm labor. But
spaced out in terms of like what, every 30 minutes? But if you are getting one maybe every minute?
Well, definitely every minute would not be. If you're getting them every 10 minutes, is already considered.
Okay, every 10 minutes.
But the question
is... It was
a
long time ago for me.
But the question is, how long do you have them for 10 minutes? Because you could have them for maybe half an hour, and then you never have it again.
Okay.
Or as opposed to if you're having them every 20 minutes, but they're for 4 or 5 hours. So that also makes a huge difference.
So how long it lasts?
Exactly. The interval of time in which you have that and how often are they happening as two things that you can monitor.
Yeah.